Good afternoon, everyone. I'm Sarabjot Pabla, the head of R&D at Labcorp Oncology, specifically at the Buffalo Lab, and it's my pleasure today to co-present some of the work that we have done with Covaris and Hamilton. I know Eugenio is going to go into really fun stuff and data from this project, but I'll be giving you some context of where we come from and why we think the solution that we have built with these teams together matters. So most of the assay that I'm going to talk about today is going to be OmniSeq Insight, which is the flagship assay that's run under the CLIA/CLAP lab at the Buffalo Lab within Oncology Enterprise at Labcorp. So the overarching principle that Labcorp has brought here to the team is that we want to have as comprehensive as possible of a testing portfolio in oncology that spans not just single analyte testing, but also comprehensive genomic profiling, right? And in order to support that, we have other teams and other capabilities around it, which is evidence generation, other panels of medical experts, including pathologists and MSLs, as well as our willingness and resources that we have put behind supporting clinical trials to then drive the clinical utility of these, some of these most complex assays. And we started doing this starting 2014-15 timeframe when we had just spun out of Roswell Park Comprehensive Cancer Center. We were a very small 40, 50 person company back then. And we moved across the street from Roswell and started this journey. For now, we have the CLIA/CLAP lab that we still run on site. So that's a single site oncology testing we do. It's CLIA/CLAP accredited and ISO certified as well. And our mission had always been to find the right trial and drug for all of our patients. It was very limited to the patients in Roswell first, and then it expanded into helping patients in Western New York region. And then our post-acquisition with Labcorp in 2021, we are now in a place where we can now help patients nationwide. So the OmniSeq Insight assay is an extremely comprehensive genomic and immune profiling assay. It overall measures 900 plus biomarkers, where we have a genomic profiling panel that covers 523 genes, SNVs, indels, fusions, copy numbers, other biomarkers such as PD-L1 immunohistochemistry, TMB, MSI, and we also have HLA haplotyping on our report, which is class 1 HLA haplotype, so we can surface HLA-restricted trials for our patients as well. In addition to that, we also have immune profiling on our clinical report as well. The panel itself has about 400 immune genes, 64 of which have been validated to be reported through New York State CLAP program. And as you can imagine, with the advent of targeted therapies around 2014-15 timeframe, where the outcomes for the patients on chemotherapy were stagnating, targeted therapy made a big difference. But there was an overlapping time between 2015 and 17 when immunotherapy was coming on the scene. And we had realized very early on that an assay that can find not only markers for targeted therapy, but also for immunotherapy is going to be useful both in drug development setting and also biomarker-driven clinical decisions. And that's when we started building this very complex assay together. If you look at the outcomes before immunotherapy, if you put all tumors together, you would say the outcomes were maybe 10% response rate, and immunotherapy almost in a grand scheme of things, and overnight doubled it to 20% and even 30% depending on who you ask. But there are still 80 to 70% of people whose cancers will come back and they will need more options. And therefore, it is very important for us to overcome some of the limitations of oncology testing and provide these patients with options that they really need. And there's so much testing now, as you can see from this graph here. With the precision medicine becoming more and more bucketed, you have so many tests to do. You can look at all of the single analyte tests you may have to do for specific markers, and then you have, combination treatments and strategies to think about. So if you look at sequence specimen requirements for just non-small cell lung cancer and some of the routine single analyte clinical testing that's required in this indication, you'll see based on the prevalence how many tests one has to do and how many slides one is going to need in order to accomplish any meaningful clinical treatment decisions, right? And here's where we think we are going to need very specific technological innovations to extract value out of minimal and very scant tissue, specifically in lung cancer where you have fine needle aspirates and very scant biopsies. And in order to go from a piece of tissue to a clinical report like this, there is a lot of other systems that are involved, and they have their own challenges as well. In our case, we have this genomic and immune profiling panel, and we have done very specific science and technology innovations in order to bring these two together. Extensive publications, peer-reviewed publications have been done in order to achieve this. And then on the quality management side, you have to make sure that a complex assay like this is built under design control and follows all the relevant CE marking and ISO regulations, and the reports are as high as quality as possible. And if you look at the overall system itself, it's a highly complicated system that requires multiple touch points, which are manual as well as automated. You have sequencing instruments, reagents, operators, labs, bioinformatics pipelines and software, servers, pathologists, and then this report is generated. A lot of people fail to realize that when a patient is sitting in a doctor's office with a report like this in their hands, how many people have worked incredibly hard to put that piece of paper in their hands, and the IT professional, the software developers who have done tremendous work to get us there, given the regulations. So as we continually try to solve problems to make this turnaround time shorter and shorter, we feel that some of the biggest challenges are the ever-changing biomarker landscape, all of these different types of tumor immune microenvironments, but the biggest of them all is sample, right? I heard someone say tissue is the issue, and I guess AMP should have that as their anthem. But tissue is the issue, and I think today Eugenio is now going to show you how we plan to solve this issue. All yours.
Thank you, Sabi, and thank you, Shah. My name is Eugenio Daviso. I'm the Vice President of Solution at Covaris. It is a great honor to be here and talk about our collaboration, the output, the impact, the performance. Covaris was founded in the late 90s, and right away, Covaris became the gold standard for DNA fragmentation, allowing to fine-tune the sizes of the DNA that are required for NGS and enabling scalability of the process for whole genome, whole exome, and panel. In more recent year, in the 2010s, we used our proprietary technology, adaptive focus acoustic, to also enable the extraction of biomolecules that can be used as a marker, biomarkers, from all these different sample types. And the story today is revolved around our effort that we did jointly with Labcorp and Hamilton, how to optimize and to create really what we consider the state of the art today for the extraction of DNA and RNA in parallel from the same FFPE sample. FFPE is one of the oldest methods to store tissue after that is dissected from the patient. The first publication that I was ever able to find dates 1893 from Bloom. And everybody knows that FFPE samples presents like a lot of challenges. And every time that there is a talk about FFPE, people complain about FFPE. It's not going to be this talk. In general, the challenges that are out there is the paraffinization, how to remove paraffin, because it's not only labor intensive, but often require also the working under a hood using hexadecaine or using xylene, and is a very manual process. There are a lot of publications out there where it's very difficult to pinpoint one exact number, but the failure rate that we found out on average is between 20 to 50%, especially when RNA is involved. I just found yesterday like a report from the Marathon of Hope, a Canadian cancer center, that reports 53% of the failure due to the poor DV200 from RNA. That RNA is becoming more and more important for comprehensive genomic profiling, especially for detecting fusion and splicing events. Suboptimal the cross-linking, that's actually one of the main points where we really focus the development of our chemistry on how to optimize the reverse cross-linking so that more nucleic acid can be used, can actually be amplifiable and work well within NGS workflow. And this correlates to the poor quality of the nucleic acid. What this is driving to, more yield is required to compensate for the poor quality. So there are certain workflows that require multiple scroll, multiple slides, like a lot of sample, and really can lose the ability to address the need where oncology is directed today, that biopsies are getting smaller and smaller. The sample is very precious. Every cell counts within FFPE. And this correlates to the needs, the ability to extract from smaller sample, fine needle biopsy, and fine needle aspirate. Scaling up the process, there is a need to increase the number of reports and the NGS analysis, comprehensive genomic profiling, because there is a lot of momentum. More and more of these tests are approved by FDA as a companion diagnostic test, and we all know now that it has like a big impact for patient health. The sample tracking of accessioning is very important to have a streamlined workflow that from when the sample is put inside the vessel for extraction, they can be traced back always to a patient. And this is also can also be related to the issue of cross-contamination. So it is paramount to have a single sample that is loaded, is closed, and avoids the spilling or cross-contamination of the nucleic acid. The ease of workflow. Every FFPE process out there, the extraction is cumbersome. Also, companies that are claiming automation is only for the last part, for the bead purification. The upfront part is very manual and require a lot of hands-on. This connects to generating the most important part at the end of the workflow, reliable data for precision treatment of patient and outcome. So this is our philosophy as Covaris, has been the philosophy that we adopted with Labcorp and Hamilton to create a workflow based on 3 pillars. Improve performance by optimizing the yield and the quality of the total nucleic acid by developing a novel chemistry that not only increases the yield, but also the overall quality that is very different from germline kind of challenges, and generate accurate and reproducible downstream data with a high degree of repeatability and reproducibility. having an impact on the economics, simplifying the QC processes and enabling faster workflow or hands-off workflow where people can be freed to do other tasks while the extraction is happening. And this moves to the ease of use. These are connected to create like a tailored automation for the need of our customers and that translate into optimized workflows. As Covaris, this is the summary of our offering. We provide instruments, consumables, and kits, and also in a more recent year, like automation. We talk to our customers to understand what the needs are, because the needs are very different. And we are servicing all these different markets, really focusing on the aspect of research, translational, and clinical. By delivering high-quality yield biomolecule, then we can enable downstream all this application. And today's story is really focused on CGP, Comprehensive Genomic Profiling. Our collaboration really culminated to development of the Sonication STAR with an Hamilton star that has embedded our Covaris AFA instrument, R230, a set of consumables that enable the ease of loading of the sample, but also ease of processing. It can be moved easily within the Hamilton star, and of course the chemistry. In addition to that, we have also been working to enable our workflow in a modular or semi-automated way on smaller liquid handler like the Starlet or also other liquid handler, also enabling the ability to purify the nucleic acid, DNA and RNA, on other devices like the Kingfisher Presto, the Flex, the Duo, and so on. This really led to time saving, hands-off, and improved overall accuracy and sensitivity for the whole process. So, and this is a little bit a summary of what I just said, with the addition that the main feature of these three products are finely tuned to address the need for delivering extraction within a shift between 6 to 8 hours. It's very difficult to pinpoint to an exact number because it depends on the workflow. On the Sonication STAR is 7 hours and a half. This is a perfect solution for high throughput, more than 7,000 samples a year, and for batches that are up to 96. We have scripts that allow the extraction in multiple of 8, and more recently also 72 that accommodates the high throughput TSO 500 kit. For the modular and semi-automation, we have developed systems that can extract up to 24 samples per batch. For throughput that are between the 600 and 7,000 samples per year. And the manual is featuring a batch of 16 for low throughput, less than 600 samples per year. How is this solution differentiated compared to the best-in-class automation competitors out there? First of all, we can provide the flexibility of the batch, as I mentioned earlier, and few can do that. We are the only one that are using an automated way to deparaffinize the sample in a non-toxic way, with a setup time that is less than 1 hour, and providing less than 5 touch points during the overall process. In addition to that, with the integration of our ultrasonicator, we provide also the fragmentation for DNA and RNA that fits perfectly in downstream library prep that are used for comprehensive genomic profiling, such as the TrueSight Oncology 500. And also we can provide the DNA and RNA from the same sample, if it is either scroll or slides that are loaded. This is how the workflow looks like. The sample is loaded in our TrueTube, and then there is a round of a coarse deparaffinization. Then there is resuspension and lysis of the sample through sonication, tissue digestion, and then the sample gets split. And here is where parallel processes are occurring on the liquid handler, so that the DNA and RNA gets purified through the bead-based chemistry. And at the end of the workflow, they are retrieved and ready to be pushed through the pipeline. This is, I find this like a great visual because it's like how the instrument looks like and how the sample looks like during the processing. This is the Sonication STAR that features an Hamilton star with the R230. Yeah. Okay, now that's better. The R230 here embedded in integrated on the Hamilton star. Here there is a decapper that allows to screw and unscrew the tubes. Our accessories that are positioned here or here that generate this seamless and streamlined work when the sample is moving inside the liquid handler. And this is how the sample looks like. Here there is one scroll. Inside the scroll, the tissue lysis buffer is added and the deparaffinization solution. Then it gets deparaffinized. The paraffinization solution is moved out. The sample is split, is lysed, and DNA and RNA are moving in parallel until you get to the end where you have a purified solution. We presented this at SLAS 2004 in collaboration with Zio to show that our consumables are also compatible with an automatic FFPE scraper that inserts the slides right away into the through tube, making the overall accessioning process like easier and faster. And we also presented this poster. This poster was the outcome of a cohort of 120 clinical samples, showing that one of the goals that we wanted to achieve, that is to increase the overall quantity compared to the to the previous current workflow that OmniSeq was adopting, show that the overall yield for DNA and RNA for high and low input sample went up between a factor of 2 and 5 for both DNA and RNA. By looking at the concordance with their clinically validated sample, we found also like extremely good value, considering Pearson coefficient for the copy number fold change, the tumor mutation border concordance, and the microsatellite instability concordance, with values that are always consistently higher than 0.98. And now these are the summary of the data that we submitted recently to SLS Technology. That is the outcome of the OmniSeq verification, clinical verification. And for this particular test, 19 different sample tumor types were taken into consideration. The majority was coming from lung and colon cancer. And the slides were stained by a board-certified pathology. And the region were estimated with 20% or higher tumor purity, and estimated less than 50% necrosis. A cohort of either small, medium, and high neoplastic cell was taken into consideration for the verification. And the tissue were sliced multiple times for reproducibility and repeatability study. Here, the box plot are representing the current performance from the verification compared to the older workflow. And in general, we did see an increase of yield for DNA and RNA, generating an average of 2 microgram or higher per extraction from DNA and RNA, and especially an overall improvement on the quality and the purity of the sample extraction by looking at the 260 to 230 ratio, indicating a less carryover of impurities from the FFPE samples. The reproducibility study were done by evaluating a set of 8 samples representing a range of tissue size that were extracted across 3 days in triplicate. So repeatability within the same sample run and reproducibility across 3 days with 2 different operators and 2 reagent lots. And the results were also really good. The yield for DNA yielded a percent CV of 14% intra-assay, so between runs, and for RNA was 13%. Within the same run, the percent CVs for the DNA yield were like 7% and RNA were 8%. This is also something that is very difficult to find out there with other workflows, the reproducibility of the nucleic acid across different multiple runs. In these other studies, the extraction input were designed to assess the impact of the tissue mass on the workflow by looking at the capacity and the yield to make sure that for high quantities of total nucleic acid, the chemistry was not going to be saturated and still generating like a linear response, and this was perfect. 3 samples were chosen from microdissection, and they were subsequently extracted by using the Sonication STAR, by using a range that was between 2 to 10 slides. Both DNA and RNA yield were linear, as you can see here, and also this study is allowing Labcorp to have like a good estimate on the amount of tissue that can be put through extraction in order to avoid QNSs. To assess if a reduced number of slides could be extracted while yielding acceptable input for NGS assay, a different number of samples, being small, medium, or large tissue mass, were also studied with 1 or 2 slides only in order to see if we could achieve a minimum quantity of DNA and RNA for comprehensive genomic profiling, being between 50 to 60 nanogram of DNA and RNA. The median RNA extraction yield for the large and medium tumor was about 4.4 microgram and 60 nanogram, which is greater than the 50 nanogram that is recommended. For DNA, for large tumor, was 2.7 microgram, and that is still greater than the 50 nanogram that is requested to run the TrueSight Oncology 500. So for this one, we are looking at sequencing metrics that are from the TSO 500, and a total number of 43 samples run through the TSO 500 pipeline for DNA and RNA libraries were prepared from extracted sample from the Sonication STAR and the previous method. 42 of the 43 samples extracted using the Sonication STAR for DNA passed the QC metric for both the Sonication STAR and the previous validated method, considering the median insert size, the median exon coverage, the median bean count for CMV target, and the usable microsatellite instabilities for an overall rate of 97.7% pass. all 43 samples extracted using the Sonication STAR for the RNA portion passed all RNA QC metric, including the RNA median percent CV at 500x, the total on target, and the median insert size with a pass rate of 100%. Comparing that with the RNA that was extracted with the previous validated workflow, 10 samples failed the QC metric of at least one of the metric for a success rate pass of about 65% on average. For the gene expression, the Oncomine assay was used, or OIRA, and 34 samples extracted using the Sonication STAR passed all the QC metrics, while the previous workflow 6 failed the QC metrics. In general, all the sequencing metrics show a higher degree of pass, and really establishing a new paradigm in the way that FFPE extracted are chemically worked out to improve the reverse cross-linking to achieve like an overall better outcome and the ability to get to a report. And this is brand new data, is unpublished, and show and represents the bar chart represents the number of samples in percent extracted per month, and they are clustered by full report that is green, that involves not only the comprehensive genomic profiling aspect, TSO500, the gene expression or the OIRA, but also if some of the sample can be partially also analyzed only with PDL1. And in general, the improvement went from an average of 89% of the sample passing to 95% on higher for the past 3 months that the new workflow has been online. In general, after launch, the Sonication STAR has been consistently reporting like good data and giving good output for the testing. So, and here we are back to, we are finally at the conclusion for the OmniSeq Insight. Is a comprehensive genomic and immunoprofiling test that integrates immune and genomic data, delivering precise treatment option and faster actionable insight for clinicians worldwide in less than 7 days, from when they retrieve the sample to when the report is ready to be sent. The Smart FFPE through extract from Covaris is the ultimate FFPE TNA extraction solution, integratable, providing very good quality and an easier workflow. And not only provides high quality of nucleic acid, but also I hope I was able to show the high degree of reproducibility and repeatability of the process across different sample types, across different operators, across different days and lots, and maximizes the yield and preserves the integrity for superior downstream analysis. And the Sonication STAR, that is the best-in-class automation out there in terms of liquid handling and movement, that together was, and together we were really able to create what we believe can differentiate moving forward the comprehensive genomic profiling from solid tumors and samples. Thank you for your time. Any questions?
About the flexibility and batch size of the system. We're not allowed this large as Labcorp. What's the sort of minimum number of samples, or how much
So we have scripts that allow from 8 to 96 in multiple of 8s, and also 72 format, that is the format for the high throughput TSO 500. So it's flexible. We have done that on other systems also, but not to this level. The fully automated workflow with up to 96 sample, we did it with Hamilton.
But is there a limitation to do it with other systems?
Sorry?
Is there any limitation to do it with other systems?
The time. It's just time, because it was an effort, and now we are up and running. It's working beautifully, but the integration per se it took like a good effort of development time. It's not impossible, but it depends what your needs are in terms of scalability and when.
Two-part question. Really nice presentation. Looks very seamless. But it looks like you have to buy all the plasticware that you guys have produced, right? There's no aftermarket plasticware, like the consumables?
We provide those components. So the way that it works is that the lab would order the Sonication STAR, and we have a very good relationship with Hamilton. We work together to integrate our accessories that enable automation, and the kit has all the components that you need to load the sample, put it on the Hamilton, and then run it.
So the second part then is that I noticed on your analysis you talked about all the different things between your competitors, but one thing I haven't seen is like maybe a cost per sample. So like yes, it might be faster.
We are compatible. It's in the same range. It's not like 3 times the price or 2 times the price.
Awesome. Thank you.
I was really impressed with the fact that you looked at the linearity with using different numbers of sections for extraction. But I noticed the slope on some of those was very different.
Yes, that's yeah.
Do you have any thoughts on it?
Yes. So and also maybe you can say something. My speculation is that samples are different. They have a different level of strength, really from a physical point of view. They have a different also content of DNA per cell depending on the cancer side. So I would believe that if it would be a normal cell, you would see like a linearity. But with cancer cell, and depending also on other component of the way that the sample is fixated, for example, then you would expect like a slightly different slope.
I think that's pretty much summarized.
Yeah.
Yeah.
Because the weird thing, I was kind of more expecting like maybe like a hyperbolic behavior or like a logarithmic behavior, but the point that is linear, it's very difficult to believe that there is something that is going wrong with the extraction. So I think it's really like the nature of the sample that depends on the cancer. It depends. One thing that we notice is that also, and is capturing the paper, depending on the size of the oral tissue that is embedded with the FFPE, then you have a more efficient. It's more efficient if you add more. So the smaller it gets, probably the formalin is like penetrating the tissue more and making it more difficult to extract. But this is really just a speculation.
Maybe related, were the tissue specimens that you used all of a similar age, or were some several years old and others newer?
That's yeah, I think we went as far So freshly cut slides, I think, go as far back as 30 days old. I think we didn't go any farther back. The blocks may be much older. And I think that data may be in the publication on the date range for the blocks themselves, but the freshly cut slides are up to 30 days old. Yeah. Okay.
Thank you.
Thanks.